Good morning. Thank you for the opportunity given to me to present my experimental result. Factors influencing sexual behavior of health students in Under District year 2018. My name is Dr. Intan Renata Silitonga, SpOG M.Kes from Pajajaran University. Introduction. Unhealthy adolescent sexual behavior can cause negative effects on reproduction health. Based on the data from Rajawali Hospital year 2016, 55 adolescent pregnancy, 17 were unmarried, 14 STDs, 6 were unmarried. Based on the data from Sinofate Research Study Adolescent Sexual Behavior, the information about sexual were gained from friends 50%, pornographic movies 35%, school 10%, and 5% from parents. The aim of this study to know the factors influencing sexual behavior of health students in Under District year 2018. The hypothesis: no correlation between reproductive health knowledge with the sexual behavior, and there were correlation. No correlation between adolescent attitude with sexual behavior, and there were correlation. Methods: held at Under District with mixed method study, quantitative study with cross-sectional, qualitative study with deep interview, observation analyzed with content analysis. Population 150 health students. Sample Lamb-Show Formula 133. The inclusion criteria: adolescent health students 18 to 21 years old, unmarried, live in Under District, willing to be respondent. Exclusion criteria: health students not at place. The results: description of health reproductive knowledge of health students in Under year 2018. The knowledge level 56% was good. Description of attitude about sexual behavior of health students in Under year 2018, 67% attitude was good. Correlation between health knowledge level and sexual behavior. We can see that knowledge level average with poor sexual behavior 66.67%, p-value 0.033. Correlation of health students' attitude towards sexual behavior. We can see attitude average sexual behavior not good 66.67%, p-value 0.06. Discussion. Description of health reproductive knowledge. Almost all had unrestful sexual behavior, 56%, such as talking, holding hands, telephone, accompanying to school. 3 had restful sexual behavior, such as kissing cheek, kissing forehead, and lip kissing. This is included in poor sexual behavior. This is appropriate with Sahabat Remaja study, adolescent sexual behavior in 4 cities. Description of attitude about sexual behavior. Almost all good attitude about sexual behavior, 56%. Someone's attitude can be known by asking directly because the person mostly knows himself. Correlation between health knowledge level and sexual behavior. 10 had good sexual behavior, 7 had good knowledge, 3 poor sexual behavior, 2 average knowledge level, 66.67%. Significant difference: the reproduction health knowledge with the sexual attitude, p-value 0.033, H-null denied and HA accepted. Discussion. Correlation of health students' attitude towards sexual behavior. 10 sexual behavior were good, 9 good attitude, 3 poor sexual behavior, 2 average attitude, 33.33%, p-value less than alpha, H-null denied, HA accepted. Effect of stabilized emotion towards sexual behavior. Breaking up relationship. Half of the informants felt sad 2 until 3 days. the recovery from sadness. Adolescent emotional development has the characteristic of emotion more up and down. Religious obedience. Almost all do religious activity diligently. All had religious teacher that teaches them how to have good loving relationship, or they should not have a love relationship. Parents. Almost all are close enough with their parents. The study of sexual behavior in Sragen family has the biggest effect in person, 73.3%. About friends. All had close friends to talk about private problems. Adolescents mostly spare time with friends the same age, especially have the same interests compared to sharing time with parents, siblings, or other social agents. According to the mass media, to watch pornography movies or Korean movies with kissing or sexual scene. According to Cinefaith research study, sexual behavior 50% information about sex from friends, 35% pornography movies, 10% school and 5% parents. Boarding house environment. Half said they live in a boarding house special for girls. Environment affects knowledge input process. Teacher. Almost all don't have a teacher that is close enough to talk about private problems. Teachers' role in giving sex education is to help the students to achieve their social and personal goal. Childhood. All informants stayed with their parents from childhood. About sexual education, all felt that sexual education that they received from the college subject was beneficial. School is the second place of education after home that gives a lot of kinds of knowledge including sex education. Conclusion. Health students' reproduction health knowledge level is good. Attitude about sexual behavior is good. Sexual behavior is good. There is a correlation between reproduction health knowledge level with sexual behavior. There is no correlation between attitude and sexual behavior. Factors more influencing sexual behavior were religious obedience, parents, friends of same age, boarding house environment, and mass media. Factors that hasn't been more managed. Effect of teacher, effect of sexual education, and the need of youth center to give adolescent sexual education service. These are the references. Thank you.